Acid reflux is a disorder that deals with your stomach, and it's a group of symptoms that can occur all at once, or not all of them can occur at the same time. But it's not just about heartburn. The most common symptom with acid reflux is heartburn, but it's not the only symptom. You can have a bloated feeling. You can have a feeling of what we call early satiety, which means that you get full very quickly when you start eating. You can have nausea. You can have lower abdominal pain. You can have a cough. You can have shortness of breath, and all of those could be related, and chest pain, and all of those could be related to acid reflux. The most common cause of acid reflux is increased acid in your stomach. And if you have too much acid in your stomach, then the acid has a chance of pushing up into your esophagus and causing symptoms. So it's an overproduction of acid in your stomach. And the cause of the overproduction of acid can be multiple things. Certain foods can cause it. Spicy foods, tomato-based products, caffeine, garlic, onions. And then there are certain foods that you guys as patients can probably say, this causes me to have heartburn or causes me to have acid reflux. Whatever food that is, that's another cause of it. The other large cause of it can be stress. Stress can cause increased acid reflux as well. One of the things your body does when it gets stressed out is it increases acid production in your stomach. And by doing that, your body thinks that you're going to go into that fight or flight mode. You're either going to throw a punch or run away. And so it wants to give you more sugar, more breakdown of your food. And so you can create more production of acid at that point. Even though you're not going to run away or throw a punch, you're just sitting at your desk or lying in bed, you can still have that same reaction. So long-term stress, even short-term stress sometimes can do it. It's sometimes difficult and it needs a little bit of a workup, but chest pain that comes from the heart, which is the common type that everybody knows about, you're going to have specific symptoms. The symptoms are going to be a pressure-like pain in your chest wall, and not sharp, but pressure-like. It will also go along with shortness of breath, increasing tiredness, weakness. The pain usually lasts longer than 2 minutes, and it's ongoing. Every time you start to exercise, you start to move, you get the pain. Different than what we call atypical chest pain or non-cardiac chest pain, which is usually very sharp. It's usually short-lived. It comes and goes very quickly. It lasts less than 5 or 10 seconds. It's usually pinpoint. You can point directly to where the pain is in your chest wall, and can be related to nausea and vomiting and other stomach issues as well. So the treatment for acid reflux, there are a bunch of different ways. Obviously, dietary is the most important. Cutting out the foods that cause acid reflux will help. Weight loss will help. Decreasing certain foods that are triggers for acid reflux, caffeinated beverages, soda, coffee, teas, anything that has caffeine in it will give you an increased risk of acid reflux. It'll increase production of acid in your stomach, and that can lead to reflux. Cutting back eating late at night. One of the other causes of acid reflux is that you're putting food in your stomach late at night and you're laying down. You are made to eat sitting up. Gravity pushes everything down into your bowels. But if you're laying down, the food just sits in your stomach and the acid builds up, and that can cause acid reflux as well. So decreasing eating at least 4 hours before you lay down at night will be very helpful to stop the reflux, especially if you're waking up in the middle of the night with it. Cutting back alcohol, smoking also can cause that. Cutting back on cigarette smoking, and eating a healthier diet will definitely help. There are a lot of medications we can use for acid reflux. It's really important. Some are over the counter. What used to be Zantac is now Pepcid, or famotidine is a really good treatment for acid reflux. Tums, also, if you have short-term acid reflux, but it's important to understand if you're eating a lot of Tums, sometimes Tums can cause a rebound acid reflux because of the calcium in it. So if you're having 5, 6, 10 Tum pills a day, you probably want to go find your doctor and get a better treatment. Certain medications can treat acid reflux, and some have been prescription strength, and now you're able to get them over the counter, like omeprazole or Prilosec, and they're called proton pump inhibitors, which work very well to decrease acid reflux. But if you need to take those long term and you haven't followed up with your doctor greater than 2 to 4 weeks, you should follow up with your doctor and make sure there's nothing else going on. you don't want to just rule out cardiac chest pain if you're not having some of the symptoms that I told you. So you want to be careful with that, and you do want to follow up with your doctor if you're having any sort of chest pain. There's tests that we can do to kind of rule out the cardiac cause versus the non-cardiac cause. And we never want to say that if you're having sharp chest pain, then it's not your heart. You need to make sure it isn't. The most important thing is that you follow up with your doctor if you're having long-term acid reflux. If you ate something that gave you heartburn once and you don't have heartburn again, you probably don't need to follow up with your doctor just for that. But if you're routinely getting recurrent chest pain, recurrent heartburn, recurrent stomach issues, it's worth it to follow up with your doctor and find a good treatment for it. That will make a big difference for you.